And I'm going to talk to you about a subject which many of us, including myself, forget to consider when we see patients with liver disease. We forget that fatty liver doesn't necessarily mean a fatty person. So I come from the United States. I spent a long time in the southwest area in Arizona and in California. First, I would like to dedicate this lecture to a great man who really changed my life. Many of you know Dr. Bill Ballestori. He was my mentor at Cincinnati Children's, and he was the first pediatrician to be a president of the American Society of Study of Liver Disease. Once he told me something I will never forget. He told me that he enjoys a lot of things in his life, but he enjoys the most teaching. And he said, the beauty of teaching is that you never know where it ends. You know, you come here or anywhere and you try to teach something and you learn a lot more than what you teach, but you never know what you teach, where it's going to end. You know, you teach someone, he's going to teach 10 or 1,000, and you never know where this knowledge is going to land up one day. So every one of us knows about NAFLD, but very few of us know what is FOO. FOO is very, very common in the West, especially the United States, which means fear of obesity. When I went to the United States about 35 years ago, I was very surprised to see obese people. We have obese people everywhere. We have obese people in Egypt, but the kind of morbid obesity we see in the United States, we don't see in Egypt. But a lot of people also have fear of obesity. That's why they are very thin. I have 2 kids, Yasmin and Kareem. They are both very thin. Their mother chases them with food every day, and they keep telling her, thin is in, fat is out. In the American society, you are not accepted if you are overweight. Well, actually, in some states, they were considering banning obese people from going to certain restaurants. Of course, it didn't fly, but it can tell you that how overweight and obese people can be discriminated against. And kids, teenagers, and college students, you know, are very worried that they are not going to be accepted in the society, and they will not join groups unless they are not overweight. So we know that the problem of non-alcoholic fatty liver disease has grown tremendously over the last 3 decades. And actually it has doubled or tripled over the last 20 years. 6% of overweight and 10% of obese persons have high ALT. The first time fatty liver was described was back in 1980 in 3 pregnant women. At that time, people didn't accept the fact that fat can cause problems in the liver. Now, people are aware that fatty liver is responsible for at least 75% of chronic liver disease, and it is one of the most common indications of liver transplant, surpassed only by alcoholic liver disease and hepatitis C, and I believe very soon that it will be the second most common indication after alcoholic liver disease. In this figure, the black figure will represent 1 million people. The gray figure will represent people with steatosis, simple steatosis. And the red one will represent people with steatohepatitis. Now let us look at the trend of obesity in the United States since back in 1985. I want you to focus on the light blue color. The light blue color will represent states in which the incidence of obesity is between 10 and 14%. 1986, you see more light blue color. 87, 88, 89, more and more light blue. 1990, 91. In 91, you start seeing a new color, dark blue, representing states in which the incidence of obesity is between 15 and 19%. 92, 93, 94, 95, 96, 97. In 97, you start seeing a new color, indicating states with more than 20%. 1998, 90, 99, 2000. You see this blue color is kind of going all over the map. In 2001, you see a new color representing states in which the obesity incidence is above 25%. 2002, 2003, 4, 5. In 2005, you start seeing a new color, which is a kind of orange color representing states with more than 25%, going up to 30%. 2006, now in 2017, you start seeing another color, which is a brownish color indicating that the incidence of obesity is more than 30%. We're talking about 2017. We're probably approaching another new color, which will indicate states with an incidence of more than 40%. And I really don't think that is limited to the United States. I remember back in high school, we had only one kid who was a little bit overweight, and everybody was mucking him around, you know? Now you go to the schools, and probably more than 30 or 40% of the kids are overweight. So we know what is non-alcoholic liver disease, but why should we care and what we can do? It's alcohol-like liver disease that develops in people who are not heavy drinker. What's a heavy drinker? One of the main reasons is that people use food in order to deal with the stress. Some people, they eat when they are angry, when they are upset, and they eat when they are happy. You know, so you can't win. And for every kind of problem, you have a different type of food which is going to make it easy on you. Why should we care? Steatosis, simple fatty liver, NASH, non-alcoholic steatohepatitis, ending up in cirrhosis due to a chronic inflammatory state. I'm not gonna go through the pathogenesis because we don't have a lot of time. And it's important to understand that fatty liver has a spectrum of hepatic pathology from simple steatosis to fibrosis with steatohepatitis and then ending up in cirrhosis. What does it mean to have fatty liver? More percent of the liver weight is fat, or more than 5% of the hepatocytes. No excessive alcohol drinking, which means 10 grams a day in women and 20 in men. It's a picture from Arizona. The prevalence will vary with ethnicity, more in Hispanics than whites and African American. And there is gender disparity, which we see only in whites. So with fatty liver more common in males than females. But when they reach the 5th or the 6th decade of life, things change, and I believe due to hormonal changes. I don't want to say the best treatment for fatty liver is diet and exercise. There is a long list of medications which are being investigated, and one probably very close, if not approved by the FDA, as the first drug to treat fatty liver disease. We definitely know that there is a link between fatty liver and diet and exercise. A relation between fatty liver and soda and fructose consumption, low intake of vitamin D, low intake of antioxidants, zinc, vitamin E, and polyunsaturated fatty acids. It's important, to know something about the natural history. And this is a question usually asked by patients and parents. However, especially in the pediatric age group, we don't know much to tell the family about it because we don't have enough prospective studies. I did one, I think the only prospective study in children, but it was limited to 5 years. But until now, beside this study, which I published like 10 years ago, we haven't seen much in the literature. But the prognosis seems to be related to histology, and we still need more and more prospective studies. Unfortunately, we know that most cases of cryptogenic cirrhosis is due to NASH. The problem is that many times when you reach cirrhosis in these cases, the fat will disappear. So you will not know that if this was fatty liver or not. It's a slowly progressive disease, may regress, stay stable for years. Simple steatosis to cirrhosis happens in about 1 to 2%. NASH to cirrhosis, 0% at 5 years and 12% at 8 years. However, 20% of patients, if they have bridging fibrosis and cirrhosis, develop HCC in 5 years. And you'll be surprised to know that I have patients who are 2 years old who already have NASH. And some of my patients, I will say like 3 or 4% of them who are teenagers already have bridging fibrosis. I have 2 patients with cirrhosis. This is a dangerous epidemic which people really don't pay much attention to it. And I'm very worried about it because in 20 years or 25 years, we're going to have a serious problem where is a huge need for liver transplantation and rare donors, because every time we get a donor, the donor has fatty liver, increased demand and decreased supply. With weight loss, you improve your ALT, your histology score, and in some of my patients, I have seen resolution of fibrosis after losing only a few pounds. The AGA recommends you lose 10% of the weight if the BMI is above 25. But the AGA also recommends that you don't lose it fast. You lose about 1 to 2 pounds per week. If you lose it very fast, you're going to end up with more fat in the liver. Physical exercise 3 times a week, 30 minutes per session. A balanced diet is very important, not the way the lady is doing. We don't ask people to stop eating anything, but everything in moderation. Exercise is very important. You exercise for 2 hours, you can eat a loaf of bread, and you're probably gonna consume more calories than you have lost. But exercise by itself will raise your metabolic rate for the rest of the day. So it's very important to stay active. As I said before, it's very difficult for us because many of us at our age are already overweight as physicians or obese, and we feel very shy, to go to the room and start, giving the patient lectures about how important is it, to lose weight, and give them a long lecture about the problems of obesity and the complications of obesity. So I try, to be kind of political about it and approach it in an easy way, but we have to be very sensitive, especially for us as pediatricians. I remember one of my patients, the mother sent me a note before I went to the room. She said, "Dr. Hassan, please stop talking about fatty liver," because the kid thinks that he's fatty. And many of these patients actually are not fat. But people hate the word fatty. That's why I think we have to be very careful when we explain facts to children. In children, it's very difficult for us because if you have fatty liver when you are 40 or 50, it's much, much less serious than having fatty liver when you are 7 or 8 years old. And the problem with liver, as you all know, that it's a tricky organ. You don't get colic like you get with the stomach, or you don't start coughing if you have pneumonia. It's kind of a creepy disease. And most of the kids will say, why should I worry about it? I don't feel nothing, I'm very happy and active and healthy. Why should I lose weight? It's very difficult, especially in the pediatric age group. If I had time, I would have went through all the medicines which are being investigated for the treatment of fatty liver, but there is one which is coming very soon, which is OCA. It's a bile acid. It's obeticholic acid, and I know it's very difficult to pronounce, and it took me some practice to pronounce it, obeticholic acid. And it went through all the requirements, and Intercept Pharma has applied for approval by the FDA. But fatty liver is not limited to obese people. It can happen in skinny patients. Patients who are metabolically obese with normal weight. You are metabolically obese, but you don't have increased weight. Many of us have patients on TBN, especially in the pediatric age group. They have fatty infiltrations. Kwashiorkor patients. Kwashiorkor is a Swahili word, which means the disease of the first child when the second child arrives. In Africa, when the mother gets pregnant and she delivers the second baby, she starts offering the first baby rice or rice water, and that's why they get protein deficiency. HCV, all of you know more about HCV than me, but you can see fatty changes in your patients. Celiac disease patients, they are underweight, they are failing to thrive, but they have fatty liver, probably to some kind of a nutrient deficiency, which will cause fatty infiltration. Cystic fibrosis patients, I know you don't see a lot of this, but this is the most common genetic disease in the world, and we see so many of those, especially in North America. All of them have fatty disease. Patients with ulcerative colitis, more with UC than in Crohn's disease. They have fatty liver changes. Something I usually forget and try to remind myself, the first thing I try to do, but I'm not successful every time, is to ask about the medication the patient is taking. Because many of these medications can cause fatty liver. But we're always looking for big diseases, and we forget that the medications, it's a simple answer. Wilson disease can be associated with fatty liver. All these patients are not necessarily overweight.
Dr. Hassan, I'd just like to remind you that the time allocated for the lecture is being ended, so try to make it fast as
This is my
you can.
last slide.
Okay, thank you.
There is a disease which I remind you and remind myself always to consider, which is LAL deficiency, LAL deficient, lysosomal acid lipase. It is as common as Wilson disease, but we never think of it. It is due to mutation of the lipase gene, which can lead to fat accumulations in different tissues. It's simply screened for by a simple blood test, and now we have a treatment for it. An infusion, which can be given, IV infusion, which can be given once a week or once every 2 weeks. Simple test, a preventable disease, and you can prevent extremely dangerous complications and outcomes. We know that not every patient with liver disease has jaundice or yellow eyes. And we also know that not everyone with yellow eyes has liver disease. Just want to remind you, by this picture, I would like you to remember it, that not every obese patient has fatty liver. But also remember that not everyone with fatty liver is necessarily obese. Still diet and exercise for non-alcoholic fatty liver disease. And I propose the term NOFLD instead of NAFLD. NOFLD indicates non-obese fatty liver disease, which is much, much more common than what we think. Diet, exercise, lose weight, but don't lose weight very fast. Otherwise, you're going to end up with more fat in the liver.
You eat some eggs, you eat some ham, you eat some butter, then brother, wham! You get those chest pains, eternal rest pains from eating lipid. You see the doc,
You
he
recognize the
shakes his
doctor?
head. With blood like this, you'll soon be dead. The fats are way up, they're gonna stay up if you eat lipid. He puts you on a diet, 500 calories. You think you'd like to try it, if there were enough to see. You lose some weight, in fact you're thin. You're in great shape, for the shape you're in. Your new condition, called malnutrition, is not from lipid.
Thanks so much for listening.